Thanks for tuning in, everyone. My name's Ali, and I'm here to present to you our poster, which looked at the onlay mesh repair method for parastomal hernias, looking at a surgeon's experience. So parastomal hernias are a common complication. They can affect up to 50% of all of our patients that develop stomas, and the risk is greatest in the first few years after it's formed. In a lot of cases, they may be symptomatic, but in selected cases, they can develop symptoms in the form of pain or recurrent bowel obstructions. Up to 70% of patients are said to need surgery because of this throughout their lifetime. And the question as to the mechanism has been a topic of debate, with primary fascial closure being associated with recurrence rates of up to 100%. So here what we did is that we analyzed a single surgeon's experience. We did a retrospective review of all patients who underwent a parastomal hernia repair between 2001 and 2018. And we looked at two different types of operations were done. In the first type, the stoma was relocated via a midline laparotomy wound, and then the hernia / previous stoma defect was closed primarily with onlay mesh reinforcement. In the second peristomal approach, a lateral incision is made about 10 centimeters away from the stoma down to the anterior rectus sheath, as you can see in figure A. The hernia contents are identified and reduced, and the defect is closed primarily. Following this, the mesh is prepared, okay, as you can see in figure C. Now, critical to this preparation is that you have to ensure the mesh doesn't completely encircle the stoma, as that increases the risk of erosion through the stoma. Finally, the mesh is placed, it's secured to the anterior rectus sheath and the bowel wall, and the skin is closed as always, as you can see in figure D. So in total, we analyzed 76 patients who underwent this method, and our mean follow-up was actually just over 7 years, between 7 and 8 years. The demographics you can see in the table there. So the majority of the patients actually underwent a repair using a synthetic mesh, 86%, and that's given our understanding that it reduces the risk of recurrence. 60% of our patients underwent the peristomal method of repair, whereas the other 40% needed a midline incision. So 11% or 8 patients developed post-operative wound complications, and our recurrence rate over that mean follow-up period of over 7 years was only 21%. In terms of wound complication rate and the risk of recurrence, albeit given our limited sample size, there was no significant difference between the type of stoma where the repair was performed, the incision type used, or whether the stoma was repaired on the same site or relocated. So, in summary, our experience shows that the onlay mesh repair method for parastomal hernias is a practical approach, particularly if you use the peristomal approach, which is relatively less invasive than a midline approach, with excellent relative recurrence rates and complication rates. However, we do acknowledge that for some patients where there's a lot of adhesions or where there's a large stoma defect, it still may be necessary to perform alternate techniques via midline laparotomy incision.